Everybody, thanks so much for listening to the podcast. If you're listening to us for the first time, please like, subscribe, and share this interview. We have Amin Azzam on again, and he's been on quite a few times. We always like bringing him back because he gives truth and honesty in everything he does. And we are going to bring him on to speak about mental health. Amin, first of all, thanks so much for coming on. Greatly appreciate it. I do want to ask you this question for people that haven't saw our previous interviews in general. Could you just give a little synopsis of what you do in general?
My name is Amin Azzam. I am a psychiatrist by training, at heart a passionate educator of health professional students at 3 universities in the San Francisco Bay Area. And I also still see patients clinically. I run psychotherapy groups for patients living with chronic medical conditions.
You know, you have a couple of kids, and obviously living in California, there's been some remote learning and also in-person learning. And obviously there's a huge fight about that. We're not going to get into that. But how are your kids doing emotionally? And, you know, from talking to your kids and their friends in general, how is all these kids doing emotionally that are in this K through 12 grade range?
Yeah, this is really hard. This has been a long, drawn-out pandemic, and with the current Omicron surge we're experiencing globally, it's definitely emotionally taxing and challenging. So I have 2 kids. One's 15 and is currently being schooled at home because of the surge, and the school decided to sort of insist that the kids be at home. And then the other one is 11, and his school is actually still in person. And they're testing twice a week now to make sure that they don't have the coronavirus spread in the school setting. So this has been really hard in school systems and hard on kids themselves. I think it's unfair to paint a super big, broad brush and say it's hard on all kids or it's easy on all kids. Obviously, local context is very, very much dependent. But I do think it's fair to say that the length of this pandemic has really been emotionally draining and physically exhausting on a lot of people, including our young people.
But there are a lot of people that do have mental health issues. I'm sure people that you see have spoke to you about this, but people in general, whether they have mental health issues or not, are struggling wearing masks. You know, I think of everything, and it says if you're in a tough situation, you know, any therapist or psychiatrist will tell you, breathe, breathe. And I'm thinking, how the heck can you breathe well with that mask on and do those deep breaths? It's a lot tougher. So the people that you're seeing, you know, what are they telling you, and people in general, what do you think they're feeling as far as this anxiety wearing masks?
Sure. Thanks for the question. I'm going to share, each time you ask me a question, I'll probably want to share some resources online for your viewers so that they can go and read those themselves. And so all of the resources are sources that I consider to be high quality information sources from reliable, scientifically sound sources. And so on this very first narrow question about, let's call it mask anxiety. I did a little bit of research for you, and I found a source. I'm going to go ahead and share a screen, and we'll just look at it together a little bit, and I'll share my thoughts as I think out loud with you about it. So I looked up some information here. I'll share screen too, and this is from the Cleveland Clinic, and it's dated September 2nd, 2020. So that might seem dated, except that, of course, the pandemic is still with us, and so I think it's still reliable information around overcoming mask anxiety. This was written by a psychiatrist, Brian Barnett. I don't know him personally, but I know that psychiatrists are highly trained medical professionals. And so here he talks about how do you work through mask anxiety. And he says it might be helpful to talk to a professional, like you said, but you can overcome it either with meds or with therapy or with a mindset change. And I want to focus just on that last one because a lot of people don't have access to mental health professionals. First one, try exploring different types of masks and wearing them around the house. So we've been around in this pandemic long enough to know there's so many different styles of masks right now. I know with the Omicron surge, we're hearing a lot of people talk about KN95 masks as a more safe version. If you're going to be at home, hopefully you're only around people who you interact with regularly. So you can try different mask styles to see which style feels less or least claustrophobic around your mouth and nose. And then here are some suggestions on challenging anxious thoughts. So specifically, I know when people let them on, they may feel, this feels so restricting. And you suggested that people taking a deep breath can absolutely do that without a mask on. You can take a deep breath in through your nose and out through your mouth while there's a cloth in front of you. And the other thing I'm going to suggest is a lot of times people who, if you're in a safe place, close your eyes when you take those deep breaths, because when you close your eyes, you have less external external sensory input, and you can really focus on that breath. Over time, those couple of those calm breaths, and you will start to not notice your mask, just like you don't notice your socks are on. Like if you pay attention to your socks, whoa, I feel my socks. But after a while, you ignore your socks. You stop paying attention to them. So that'd be my advice on that specific question.
Amin Azzam here on Fire Breathing Rob. How do we talk to our kids about the vaccine? There's so much misinformation out there, whether it's on the internet, whether it's kids talking to other kids at school. It's just really scary. And as far as that goes, so, how would you talk to the kids about the vaccine and get rid of that misinformation? And also, should they be getting it? Because they do have, most of them have good immune systems.
Yeah, so I'm a strong believer that our children should be getting the vaccines once they are permitted to do so in their age range, because it will reduce the seriousness of COVID should any of them get COVID. And so obviously the guidelines will evolve over time as the research continues to be done and as the science emerges on the safety and efficacy of vaccines. But in terms of talking to our kids and sort of reducing sources of misinformation, ideally are the trusted, loved adults who care for children are the ones that they should feel the most comfortable talking to about all this. And so we want to create as much space as possible for children to talk to us, to express their fears, worries, hopes, concerns, confusions, et cetera, et cetera. So, what I would say is create as many opportunities as you can to talk to your children and any children that you interact with about coronavirus. If we don't talk about it, they might believe that it's so scary that we shouldn't discuss it. And if we bring it up with them, they will meet us where they're capable of meeting us around fears, worries, anxieties about coronavirus. I'll share another resource, and then if you have a follow-up question, please feel free. So again, coming back to my department website of psych.ucsf.edu, up here, mental health resources for crises. I'm going to scroll down to resources for families with mental health challenges, right? So we'll just click on that. And so in this section, it's very specifically talking about families that might have children with diagnosed mental health issues or concerns. But you had mentioned earlier about acting out in school settings. So here's a link to emotion regulation issues. If we scroll down there, you're going to see some advice to adults and parents about talking to kids about how to handle regulating our emotions. So here's an accept picture around activities, contributing, comparisons, emotions, pushing away thoughts, sensations. So we don't have time to go into all of the details here, but what I'm trying to show you is some resources for how to talk to kids about COVID.
So how do we talk to people so we don't wear them down even more, that this could be some reoccurring thing where they're going to have to wear these masks for 2, 3, 4 years and have to get so many vaccines? And, we talk about suicide. How many people could that create, suicidal thoughts for?
It is a real challenge. And I know that we're dealing with an infectious pandemic right now. I think that we're experiencing a tremendous burden of emotional well-being, mental health concerns throughout the globe. And so we haven't formally labeled it a mental health pandemic as well, but I think it's safe to say that we're going to see increases in the numbers of people that are dealing with emotional distress, well-being challenges, anxiety, depression. So I think my immediate answer around that news sort of feed is to turn off the news. We can, I would liken it to a dose kind of thing. You want to exercise, but not too much, not too little, not too much, just right. You want to read the news, but not too little and not too much, but just right. So I think that I'm going to advise people, if you feel that you're getting overwhelmed by all of that news reading, channel surfing, sort of blog posting, Twitter reading, you have the power to stop reading those things because it will reduce your distress or anxiety.
Again, I thank people for listening to this important topic. I think if you are enjoying this, please share, like, and get this interview out to as many people. It's really important what we've been talking about with Amin, and he's a great resource to have on. Amin, let's talk with the last two questions about this. Any advice for young people, parents, and kids throughout this coronavirus? Because, people are struggling, whether it's mental health, physical health, and also many other things that we won't even go into.
Yeah, thanks again for the opportunity to share resources. So I'm going to offer, I've already shown you my department website, public facing resources. I want to talk about some national US organizations that also have high quality information for families and individuals struggling to cope with the emotional impact of coronavirus. So I'll share a screen and show you two more resources. The first one is from the American Academy of Child and Adolescent Psychiatry, aacap.org, not .com. It's not, they're not trying to sell anything. They're a national organization of child and adolescent psychiatrists. And so if we go to acap.org, I'll just show you, if we start there at the top of their website, there are some resources, resource centers about schools and about emotional dysregulation, like you talked about earlier. And then I'm just going to show you where, what I was looking for was, how do you help families, right? And so where was that link? Look for it here. Families/youth. So facts for families right up at the top here. So we're going to click on facts for families, and there's some information about all sorts of different kinds of things, right? So you can read about, if you have an adopted child, for example, information about that. There's a bunch of resources here. And I think actually at the very top of the website, I forgot to see it, there should be like a COVID-19 resource link. Now I can't find it, of course, but let's just make sure. Let's look for it quickly. Can't find it on this one. You can edit that part out. So, okay. So one of the resources I want to share with you, sharing screen here, is from the American Psychiatric Association. So psychiatry.org. I'll just show you how I got to that website, psychiatry.org. So this is the national organization for psychiatrists and other mental health professionals in the United States. And they have a coronavirus COVID-19 resources and information hub right here in the top right of their website. When you click on that, you're going to get to this web page, and it shows you a bunch of resources. Again, I like to say overwhelmed in a good way. So here's a bunch of hotlines that you can call, resources for mental health professionals as well as others. And then there's a link for resources for families. So you were asking me about how do we talk to people. Here's a list of lists again around the American Psychiatric Association's Center for Workplace Mental Health. Here's a list from the American Psychiatric Association. Here's from the National Child Traumatic Stress Network. The next one down around the American Academy of Child and Adolescent Psychiatry. And so I'll click on that one just to show you, again, a list of lists of high quality health information resources. So here's resources for families, telepsychiatry resources, advocacy resource for health professionals. So a long list of good things that can help you. So for example, you asked me earlier how about resources for kids. Here's a comic, how to turn your home into a school without losing your sanity. And I'm sure there's a lot of parents that might really appreciate this posting here about advice on how to make homes a healthier, more safe emotional place for our kids and loved ones.
And so, Amin, I know that there's many other resources. I know UCSF.edu, the psych department has a lot of resources. Anywhere else you'd like to recommend, or even on that page, there's so many resources. Anything else you would like people to look at?
Sure, thanks. I will share, we live in a society where a lot of people have a lot of apps on their phones and have a lot of smartphones that people carry around with them. So I want to share a couple of resources there. So sharing once again. So again, psych.ucsf.edu. And then from our website at the top here, the list of lists. So we'll just go ahead and look at the useful wellness and mental health apps. So if I click on that, you're going to see a bunch of resources from different organizations and apps. Most of them, I think, are free. Some of them might charge you, but again, we vetted these in our department as resources we believe to be scientifically valid, emotionally sound, high quality resources. And so having those at your fingertips literally are incredibly useful resources so we can all get through this pandemic together.
Amin Azzam, thanks so much for your time. I greatly appreciate it. Where can people find more about you and learn more about you?
You can certainly look me up at my UCSF department website profile. You'll easily find me. You can Google me. I'm sure there's going to be places around that will give more information. But because I am an academic psychiatrist at UCSF Department of Psychiatry and Behavioral Sciences, everything from there is highly reliable and accurate about me.
All right, Amin Azzam, thanks so much for your time. This will not be the last time we have him on, so definitely stay tuned. Thanks again.
Stay healthy, everyone.